Good day everyone, I'm student nurse Mary Louise Arlos from University of San Agustin, and in this video I will show you on how to perform priming of IV infusion. So first you have to check the physician's order sheet so that we can provide a right patient, right dose, and right drug. Then wash your hands to prevent contamination. So after we verify the physician's order, we have to assemble our materials. And these are the IV fluid, or the IV bottle, the IV tubing, our gloves, our ladle, and our kidney basin. Then identify the patient by asking for his or her name and for his or her birthday. And don gloves to protect you from any microorganisms. Open the tubing packaging and unkink it. Then roll the clamp to the closed position. Make sure that there is no obstructions in the tubing. It should be checked always to prevent errors in the procedure. And move the roller clamp about 3 centimeters below the drip chamber and close the clamp. Then you have to check the IV fluid for the expiration and the clarity. And hold the IV bottle in your non-dominant hand upside down. Then put label on both IV tubing and the bottle. Then pull stopper off spiking port. Make sure to keep it sterile and do not touch the spike, for it will be the one that inserted on the IV bottle. Then spike the IV bag by inserting the spike into the spiking port. Do this by performing a twisting motion. And hang the bag on the IV pole. Then squeeze the drip chamber until halfway full. This would be the start for the priming of our IV infusion. Then after that, unclump the clump roller and allow the solution to drain all the way through the tubing. Check the tubing and make sure there are no large air bubbles. You can flick it or reflash the line again to remove them. But in my case, there are no bubbles present. Make sure there are no bubbles in the tubing, for it may cause embolism to the patient. Then after that, clamp the tubing shut with a roller clamp. Then close the end by a sterile protective cover and hang it with IV bottle. Then after the procedure, we are now ready to connect it to the patient. Dispose used materials and then wash your hands.